My Doctor, your health anytime, anywhere. Hello, lovely people. Welcome to the My Doctor podcast. My name is Mwesigwa Joy and I'm your host. Thank you for tuning in. So basically on this podcast, what we do is we promote health, yeah? We want you to know about your health, but give you knowledge about health. How can you prevent certain diseases? How can you know the signs and symptoms? When should you seek for help? What programs are available for you? What rights do you have as a person towards health? Everything to do with health, all aspects of health, mental health, gynecology, everything. So thank you for tuning in and you're in the right place. So for today, we're going to be talking to a person from Ministry of Health and I'm really excited. And we're going to be talking about the advancing health programs that they have for us as Ugandans, right? The advancing health programs. And I'm here with Mr. Emmanuel. You're very welcome to the show, sir.
Thank you for having me.
You're welcome. We're very happy to have you. Could you please introduce yourself to the audience for them to know who you are and your role? Yeah,
my name is Emmanuel Ainebyoona. I work as a Senior Public Relations Officer at the Ministry of Health.
Okay. So our topic today, we would want to know about the advancing health programs that Ministry of Health has in place that our people can benefit from. But before we dig into that, I would like you to maybe talk to us about the roles of Ministry of Health, like to a layman, yeah? Yeah,
to a layman, the Ministry of Health is responsible for policy coordination and partner coordination to ensure health service delivery at all levels, because we have primary health care and also tertiary health care. Before someone gets ill to go to the hospital, they are at home. So there's that primary health care where you start from. When you get ill and you have a complicated ailment, let's say cancer, and you need to go now for chemotherapy, for radiotherapy at the highest level, now that is what we call tertiary care. So as the Ministry of Health, we coordinate policy, strategy, and also partners, and also mobilize resources to ensure that the Ugandan population get the services they need, and also ensure that we save lives. Yes. Yeah,
and I think you're doing a great job. As a medical student, we are seeing what you're doing. It's a great job. And so in regards to the advancing health programs that you have for us, there have been videos moving around about a malaria vaccine that is coming up. So I'd request we talk about that. Maybe someone out there would be wondering, this vaccine, is it available for which category of people? Is it safe? How can they access it? Is it out yet? Yeah.
Yes, we are rolling out the malaria vaccine come this year in April.
Okay.
And this is going to be one of the biggest rollouts compared to the other countries. And we are using vaccines that have been a part of a scientific process. They have been under testing, review, and they are safe and efficacious. So we expect to roll out in April. Okay. And this is is part of our malaria reduction and elimination strategy of 2025, which we are in this year, and is one of the interventions. As you may know, malaria is the leading cause of illness and death in the country for many years now. So a vaccine that has been tested, tried and approved by the World Health Organization, and also locally, we'll hope that it will help us to reduce on the severity of the disease and also reduce on hospitalization. When we immunize the children who are our main targets, who are between around 6 and 13 years of age, we'll be able to minimize on the people that come to hospitals seeking for treatment day in, day out. Because when you go to the hospitals, you find queues of people, and it even keeps people away from their jobs. So it is a time-wasting disease, it is a costly disease, and can send people into poverty and disrupt their ways of life. So the vaccine that we are going to roll out will be offered at 6 months, 7 months, and 8 months, and also at 18 months.
Okay.
So it will be 4 shots administered over that space time.
Okay. So does every child qualify to get the vaccine?
Yes, all children qualify unless they have any underlying conditions. But for now, every child qualifies to get the vaccine to protect themselves against malaria.
Okay. So also in regards to the vaccine, as we know, sometimes people who live in rural areas, they get the information last, maybe because of the communication gap. So do you have any strategies for people in rural areas? Would they get the same rollout here?
Yes, we're already in advanced stages for the rollout of the malaria vaccine. We have scheduled engagements already that are running at the high level and also at the community level, at the interpersonal level.
Thank you so much for that. Our viewers, hope you've learned something about the malaria vaccine, and we're really excited for it coming in April, right? Yeah, so I would want you to take you to another aspect of health that is also, our Ugandans also battling NCDs. Those are like diabetes, hypertension, mostly in the urban areas. So does the ministry have some strategies that in which we can help these people with those living with those chronic illnesses?
Yes, we have a strategy and we have a department that is responsible for formulation of strategy and guidelines to control the burden, the growing burden of non-communicable diseases. And they've been doing even surveys to an extent that in 1 in 4 Ugandans will have a raised blood pressure. So that is a sign for concern. And mostly the non-communicable diseases arise because of our lifestyles and diets. So we have also what we call the National Day of Physical Activity. I hope you've ever heard about it, where we want people to participate in physical activity because it is physical activity that will help us to control some of these lifestyle diseases, and also eating healthy diets and avoiding these sedentary foods that are dominating our restaurants, and also avoiding alcohol intake such that we minimize on the risk factors that drive these non-communicable diseases. So at the level, we ensure that we are testing, screening for these non-communicable diseases. We have a program where we intend to have at the community level where people are screened for hypertension, for diabetes, and also cancer screening, for instance, like breast cancer, prostate cancer among men, and this is done early. And there is also a planned mandatory screening for all those ones who are males who are above 45 years, such that we screen them for prostate cancer. Yes.
Okay. You talked about the National Day of Physical Activity. When is it? Maybe someone out there would want to participate.
It normally happens in the second week of July annually.
Okay.
And it is an annual event meant to encourage Ugandans to participate in physical activity. But physical activity is also a personal choice, and it is a personal responsibility. So you can decide to at least dedicate some time daily off your busy schedule, either to jog or to play a sport you would like, something that will keep the metabolism or the body active, and this will enable you to tone down. For instance, myself, I've decided to at least walk for an hour every day. So from here, I'll be changing from this attire into a sporty attire, and I walk a distance covered in an hour. So that is one of the actions I take as a way. So, and I appeal to anyone out there who is listening to this or watching this podcast to make a choice and live a healthy lifestyle by having something that will keep their body physically active.
Yeah.
Thank you. But also those that have been diagnosed to have either hypertension or diabetes, to ensure that they go for regular checkups and also stick and adhere to their prescribed medications. Yeah.
Yes. So still in regards to advancing health programs that you could be having, another pressing issue that we have in community is mental health. There's stigma around mental health, and sometimes people assume that mental health services are expensive. When someone has a problem, they don't seek for help. So does the ministry have any provision for that mental health, or like, is there any way someone can get help?
Yes, mental health, like non-communicable diseases. We also has a focal person and a desk in the Ministry of Health, where we ensure that we formulate policy to advance mental health services across the country. All our regional referral hospitals have mental health units, and we also have a national mental health referral hospital in Butabika, where the services can be provided to people who are mentally ill. And even at the community level, we have mental health services provided, we have health talks provided. But all what I can appeal is that we have to be supportive to our loved ones. If someone has stress, is working under pressure, they are likely to get stress and depression. So we need to embrace our loved ones. If you notice something is not right, talk to them, get them a counselor, seek services of a psychiatrist. Thank you.
So as we recall, in the past years, we had a pandemic that was COVID-19, and it took the whole world. The whole world was shocked. It took all of us by surprise. And I feel like maybe the whole world wasn't prepared. So is there a way that maybe the ministry is preparing for, in case there's another pandemic? We're not expecting one, by God's grace, but how prepared are we as a country if in case we fall into another pandemic? Yeah.
Yes, thank you very much. Uganda is one of the highly recognized countries as far as managing epidemic and pandemics. If you recall, the Lancet recognized Uganda for being the best on the continent in terms of managing the cases of COVID-19, and globally we ranked number 10. At the time, the Lancet Commission made an evaluation on how countries were responding. So we have built resilient systems that are able to detect and also respond to these emerging and re-emerging epidemic diseases. So we have our surveillance teams, we have built capacity for our laboratory such that they are able to test and even support other laboratories on the African continent. Recently, last year, November, our president was awarded by the African Society for Laboratory Medicine for supporting laboratory to an extent that Uganda supports the neighboring countries to build capacity in laboratory and testing. So that tells you that we are more than ready to respond to any emerging outbreak.
Yeah.
Yes.
Okay. So also an aspect, we talked about health communication in the beginning. So in regards to that, do you believe that digital innovation could improve our services in Uganda, and how best can we embrace it? Like my doctor is trying to bring telemedicine into the picture, and other organizations are trying to do that. So how best can we embrace that?
As the Ministry of Health, digitization is top on our agenda in terms of services delivery. For instance, managing the supply chain of the medication, patients' records. We have what we call like electronic medical record system we are currently implementing, and annually we hold even the digital health conference. We recently had the launch of the national data warehouse to store all this data, patient information, accessibility to information. And also an initiative like My Doctor will enable people to be enlightened, to know and understand the health conditions, know the risk factors like we have talked about, alcohol consumption, know when to go for screening, for instance. Why should you get worried? Because like in terms of non-communicable diseases, for instance, cancer, if you're able to know the signs and symptoms, then you're able to go for screening early. And early diagnosis will enable quick treatment. Because if you are stage 1 for cancer, you are at more chance of survival. Unlike someone who has showed up when the cancer is advanced in stage 4. So digital communication, telemedicine are the way to go. Everyone should embrace it. Someone should be able to consult a doctor virtually. You should be able to know how to contact, for instance, a hub guy to deliver your sample, to pick your sample for the like it was the case for COVID, where you have your sample collected, taken to the laboratory for testing, and also results returned electronically through WhatsApp or any available platform. Already now, like for the sexual reproductive health products, you're able to order for a testing kit from a pharmacy without you visiting the pharmacy. So that is the way to go, and My Doctor is an addition to that process of ensuring that we make lives better, such that people are able to access health services in the comfort of their living rooms.
Okay, so eventually we've been talking about communities, so I want to flip the page a bit and talk about the medical personnel. Let's start with the students, yeah? Are there any programs or opportunities that Ministry of Health could have for the students that are in line with health, and maybe also the interns, and some people are worried about the backlog and everything? What programs could you be having that could be of help to students?
Of course, we have always collaborations with the students associations. For instance, Medical Students Association, as you've talked about, we have interns. We have had the challenge of backlog because of the regulating the numbers. There are numbers coming in who are more than the training facilities that are available, the training centers for internship. But we are working on an internship policy that will enable to ensure that we plan, and the universities also take on numbers that can match the available facilities for training. And that is important for the quality and the quality of training, and also the product of a medical personnel that comes out of the training system. So we always keep in dialogue, but we hope that the policy on internship will be concluded. For the continuing students, they keep also following the digital channels for any opportunities, because we have surveys that happen, which might be an opportunity for those ones who are at school. We have volunteer opportunities, like for instance in emergency medical services, you can volunteer as a paramedic to support the emergency accident and rescue operation. So there are very many opportunities for those ones who are aspiring to join the medical field. And also scholarship opportunities are always available either through the Ministry of Education or the Ministry of Health for those ones who wish like to specialize. From one degree to now become more specialized, either become like gynecologist, you become an ophthalmologist, or you want to become a cardiologist. So there are always opportunities, and also fellowship programs. I saw the other day Uganda Heart Institute had advertised for those ones who wish to specialize in matters to do with heart surgery. Yes.
Okay, so we are almost at the end of the episode. So I'd want us maybe to wrap it up this way. Maybe you could talk to the people and tell them sometimes people don't know where they can find the free health services, or like maybe they don't know what a referral hospital is. Someone could be out there and they don't know, and they're suffering at home, and they don't know that the Ministry of Health has actually made it possible for you to access healthcare freely. Yeah. So maybe you could tell us about the levels, like maybe National Referral Hospital, then this one. Yeah.
Thank you very much for that very brilliant question. Many people do not understand the referral system. We have referral guidelines, and we have, as I said, we are present as a Ministry of Health right at the village level. That's where we have the village health team, mostly known as a VHT. At the parish now we have a community health extension worker whom we refer to as Qs. And those ones are able to link you to our first level of structured facility, which is now Health Center 3. Health Center 3 should be able to treat a number of ailments, even deliver normally a pregnant woman. Then from there we go to at the constituency level where we have a Health Center 4. Health Center 4. Health Center 3 now will also have a medical doctor under the proposed reforms. We are going to have medical doctors, because previously Health Center 3s would be manned by the in-charges who are clinical officers. But now we'll be having medical officers at Health Center 3. Health Center 4 is able to do surgeries. It has a theater and handles a wide range of conditions. From there we have a general hospital, which normally they refer to as a district hospital, which also handles a number of discipline, and it also has a number of specialized staff. Then we have the regional referral hospital. Regional referral hospitals like Kabale, Mbarara, Masaka, Jinja, Arua, Guru, Yumbe, Kayunga. These ones have consultants, so specialized medical personnel. We have been talking of cardiologists, I've been talking of gynecologists, I've been talking about ophthalmologists, so pediatrics. So you'll hear like consultant, pediatrician, consultant, senior consultant, gynecologist. So from that level, and that's why we expect that a patient should begin at the lower facility. If a lower facility cannot manage the patient, then the patient is referred to the next level. And there is clearly a pathway defined for how the patient should be referred. So from the regional referral hospital, now we go to national referral hospitals like Mulago National Referral Hospital, Kawempe National Referral Hospital, Chirudu. So these ones can receive patients from regional referral hospital. At the regional referral hospital serves a number of districts. Then now, if the patient cannot be handled at a regional referral hospital, then they can be referred either to Kawempe for matters of women affairs and children, then medical, for instance, burns, dialysis, Chirudu, then also Mulago handles a number. So we also have specialized institutions like the Uganda Cancer Institute, the Uganda Heart Institute, the Mulago Specialized Women and Neonatal Hospital. But also we have, I said, Botabika National Mental Referral Hospital for those ones who are mentally ill. So those are the layers and levels of med services. And largely a policy is Uganda healthcare is free at most levels. Even cancer care, for instance, even though expensive, we provide it for free. But of course, there are still some challenges where you find the reusables, medicine sometimes are not adequate to cover all those who are in need. But even our regional referral hospitals have private wings. If you don't want to go to the general general ward or general wing where services are free, you can go to the private wing where you can be able to pay and have a quicker service. Because services are free in our facilities, they are characterized by huge queues and also waiting time. So those who can afford can visit the private wings of this regional referral hospital. And we have also put out an initiative called the Client Feedback Initiative, where you can scan a QR code. It is available on our website. We have made that QR code available at most locations in our health facilities to get the feedback. If you went, for instance, to Kabale Regional Referral Hospital, how were you received at the gate? How did the consultation go? Were you asked for money when it is not supposed? You can scan that QR code and you are able to give us your feedback, which we receive instantly and informs what action we'll take. So we now have but thanks to technology, digitization, we have a platform where we have empowered our clients to tell us about our health service delivery as a way of understanding their satisfaction. Thank you very much.
So I'm interested in the QR code. Is it anonymous? Like if I'm a client and I'm typing my feedback, will they know who I am, or it's...
It is optional because it gives you an option of not saying your name. But of course, we also want to guard about faceless individuals. That's why even technology asks you, are you a robot or you're not a robot? Because someone might have a personal vendetta against a certain health worker and might want to put information that is wrong. And that's why we have encouraged data all our health workers put on their uniforms that are well labeled. And also the clients, you are at liberty if you feel like you're being taken advantage of, for instance, being asked for money, you can take a picture and the platform allows you to upload that picture of someone who asked, for instance, for a bribe or someone who frustrated, talked to you rudely in the course of seeking health care at the public health facilities.
Okay, so lastly, still about the QR code, because it was sent in, I'm a medical student, so it was sent in our group. And another issue people had was, like you've said, someone could have a personal issue with you and they decide to tarnish your name. So how protected are the health workers in this aspect? Because in case someone has just put out something that Joy asked for a bribe, but they haven't presented evidence, and it's just one person, how best have we protected our health workers from such malice?
Of course, we have the Health Providers Rights Charter and the Patients Rights Charter. It prescribes what a medical worker should do, and also the Patients Rights Charter prescribes what are the rights and responsibility of a patient. What should I know when I come to the health facility? So that is provided. But of course, even when we are doing the rewards and sanctions, that is like disciplinary, everyone is given a fair hearing. You are given, for instance, if there is someone who has said so and so, or you have been found of extorting money from your patients, then we give you the offenses you've committed and you're given an opportunity to respond. And there will be also what they will call the rewards and sanctions committee, where you are supposed to appear and defend yourself. And even with that, there is what they call interdiction. You can be interdicted as they do investigation. If there is no evidence that is found against you as per the allegations, then you are reinstated into your role.
Your role.
Yes.
Okay, so I think we have come to the end of the episode. So as we close the episode, I'd want you to look into the camera and say like closing remarks to the people, anything you'd want to say to the people out there.
Yeah, thank you very much. This is a very important podcast, My Doctor, and we are happy and embrace it as a Ministry of Health, because it is an available platform to reach out to the population we serve. And the emphasis will be on our client feedback initiative, which is a QR code. Everywhere you go across the country and you are seeking services, you have challenges, please, you can give us your feedback through this QR code. It is available on our website. It is available on the Ministry of Health social media handles, and we'll be able to pick and process your feedback, which will enable us as a Ministry of Health to improve. But also, most importantly, is to call upon you to embrace the malaria vaccine once it is rolled out, because it is the only gift you can give to your child to ensure that they are not disturbed by malaria, which remains the leading cause of illness in Uganda. Thank you very much.
Thank you so much, Mr. Emmanuel. Thank you for honoring our invite. I'm sure people have learned a lot, and we, on behalf of My Doctor, want to thank you and the ministry for the great work, and we hope to be part of these advancing programs in the future. To our people who have been watching, hope you've learned a lot. What is the take-home message? We have a vaccine that's coming out in April. So if you're a parent, embrace it, save your child, like Mr. Emmanuel has told us. And we have also talked about the health facilities. Healthcare in Uganda is free. You have an opportunity to get free services from all the levels that we have mentioned, right? So embrace all that. And also, there's the QR code. If you want to give your feedback about the facilities, please embrace the QR code and use it, and let's make the health system in Uganda better together. Thank you so much for watching. We'll be having these episodes every Saturday, so tune in. We'll be having different topics. We have different guests aligned for you, so we have a lot in store for you. This is the My Doctor podcast. My name is Mwesigwa Joy. My Doctor, your health, anytime, anywhere.
My Doctor, your health, anytime, anywhere.